have major responsibility in the body's homeostasis. Problems to these organs can result in some serious complications. In this video, we will list the numerous functions of the kidneys, identify the types and stages, as well as risk factors for developing kidney disease. We will list symptoms and identify potential complications of kidney disease. The kidneys are the body's main filtration center. The nephrons are the functioning units in the kidneys where all of the blood in the body flows to filter out waste products and then excrete through urine. In a sense, the kidneys help to clean the blood. The kidneys have numerous functions. In addition to eliminating waste products such as urea, uric acid, toxins, and other metabolic end products, the kidneys regulate fluid, electrolyte, and acid-base balance. The kidneys also regulate blood pressure and activate vitamin D metabolism, which is needed for healthy bones. The kidneys also make erythropoietin, a hormone needed to make red blood cells. There are three main conditions affecting the kidneys: nephrotic syndrome, acute renal injury, and chronic renal disease. Let's begin with nephrotic syndrome, which is not a specific disease, but rather a group of symptoms. Nephrotic syndrome causes increased permeability of the glomeruli in the kidneys, which allows larger molecules like protein to leak into the urine. This leaves low levels of protein in the blood, known as hypoalbuminemia. It is also associated with hyperlipidemia caused by increased synthesis of lipids. Another manifestation of nephrotic syndrome is edema caused by sodium and fluid retention, as well as hypoalbuminemia. Nephrotic syndrome can be reversed, but can also lead to both acute renal insufficiency or chronic renal disease. The next disorder is acute kidney injury, which is most often caused by an illness, injury, infection, or toxin that stresses the kidneys. It develops rapidly with a sudden and significant loss of kidney function. In some cases, acute renal injury can be reversed. However, depending on the severity, it can have life-threatening consequences if it progresses to renal failure. Unlike acute renal injury, chronic kidney disease develops more slowly, usually with permanent and gradual deterioration of the kidneys. It is most often caused by poorly controlled diabetes or hypertension. It is estimated that diabetes accounts for about 44% of those who have kidney disease, and more than a quarter from uncontrolled hypertension. Obesity, smoking, and elevated blood lipids also increase risk. Eventually, chronic kidney disease will lead to end-stage renal failure with complete shutdown of the kidneys. There are 5 stages of kidney disease, with stage 5 being end-stage renal disease. No matter if a person has acute or chronic kidney disease, most of the consequences of poorly functioning kidneys are the same. One of the hallmark signs of loss of kidney function is decreased glomerular filtration rate, known as GFR. The glomerular filtration rate is a measure of how well the glomeruli in the kidneys are able to filter out waste products. The GFR is used to help determine the stage of chronic kidney disease and how to treat medically. There are many symptoms of kidney disease, including fatigue, loss of appetite, weight loss, and weakness. Gastrointestinal symptoms such as nausea, vomiting, and diarrhea may occur, along with sore mouth and bad breath. Another very common occurrence with kidney disease is edema due to the kidney's inability to regulate fluid balance. This is often referred to as pitting edema, which is evident in feet and ankles. There are many complications of kidney disease, which sometimes can be life-threatening. Severe anemia is usually present due to the body's inability to make red blood cells. Iron and folate deficiency can also aggravate anemia. Excessive bleeding can occur due to impairment of platelet function. Metabolic bone disease also occurs from the body's inability to metabolize vitamin D. In children, there is growth impairment due to malnutrition, bone disease, resistance to growth hormones, and reduced levels of sex hormones. People with renal disease also have a high risk of infection, neurological problems, GI bleeds, blood pressure abnormalities, and cardiovascular disease. Of particular concern is buildup of electrolytes, such as potassium in the blood, which can lead to heart failure. In advanced kidney disease, uremic syndrome occurs due to a buildup of waste products in the blood. Uremic syndrome can be defined as the terminal clinical manifestation of kidney failure. Signs of uremia are progressive weakness and fatigue, loss of appetite due to nausea and vomiting, muscle loss, and metabolic acidosis. Without intervention with dialysis or kidney transplant, uremia due to renal failure will progress and cause stupor, coma, and death. Once kidney disease reaches an end stage, treatment will require kidney transplant or dialysis. Dialysis is necessary once 85 to 90% of the kidney function is lost. The purpose of dialysis is to filter blood in replace of the kidneys. There are two types of dialysis, peritoneal and hemodialysis. The picture here shows peritoneal dialysis, which uses the body's peritoneal membrane in the abdomen to filter waste. While it can be done at home, it requires 4 to 6 treatments of infusing and draining dialysate through the peritoneal cavity each and every day. Hemodialysis is the most common type. Hemodialysis uses a machine that acts like an artificial kidney. It filters all of the blood and does what the kidneys can no longer do. It is typically done at a facility where health professionals administer the treatments. Through grafts placed in an arm, blood is removed from the body and pumped through an external filter to remove waste before returning to the body. Kidney disease is a serious problem that must be treated, or it can lead to death. As you consider how the loss of kidney function affects the body, think about how nutrition will be impacted and how it is used to prevent further complications.